6 health checkups to avoid after 65 that could do more harm than good. 90% of older adults unknowingly skip these 6 common health checkups tests that most believe are keeping them safe, but could actually be doing more harm than good. Today, we're revealing the truth behind them. Before we start, let us know in the comments if you're watching from the very beginning, because what you'll discover in the next few minutes might change the way you think about routine health care forever. Stay with us and see if you've overlooked any of these 6 tests that could quietly steal your strength, your independence, and your peace of mind after 65. Number 1. Colonoscopy for those with no symptoms and a history of clear results. There is a hidden risk that many people do not realize when agreeing to a routine colonoscopy after the age of 65 with no symptoms and a history of clear results. For decades, colonoscopies have been praised as a powerful preventive tool for detecting colorectal cancer. In younger adults, especially those between 50 and 60, the benefits are often worth the preparation and sedation. But as the body ages, the balance begins to shift. What once was a routine screening can quietly become a source of unnecessary danger, stress, and loss of independence. Aging is not just the passing of years. It is the gradual change in every system of the body. The liver metabolizes sedatives more slowly, which means those medications can linger in the bloodstream longer, clouding the mind for hours or even days. The brain, more sensitive than it was decades ago, may react with confusion, memory lapses, or temporary disorientation. The cardiovascular system becomes more delicate, and a sudden drop in blood pressure from dehydration can trigger dizziness and falls. The bowel preparation itself, involving large amounts of strong laxatives, is a challenge for anyone. But for older adults, it can cause severe dehydration and dangerous electrolyte imbalances that upset heart rhythm and muscle function. One story often remembered in the halls of geriatric practice is about Helen, a 8-year-old retired teacher. She had lived an active, joyful life and had undergone 2 previous colonoscopies, both yielding clean results. When her doctor suggested another just to be safe, she agreed without hesitation. During the night before the procedure, weakened from the bowel prep, she became dizzy and fainted in her bathroom. The fall fractured her hip, and while she survived the surgery, her walking was never the same. Helen's independence was suddenly limited, not because of illness, but because of a preventive test that was unlikely to change her future health. Such outcomes are not rare. Data published in JAMA Internal Medicine reveal that for adults over 65 without symptoms and with a history of negative screenings, the chance of finding a life-threatening cancer is very low. Yet, the risk of complications like colon perforation, significant bleeding, or severe dehydration rises sharply. Many polyps found in older adults are slow-growing, often requiring 10 to 15 years to develop into cancer. For someone in their late 60s or 70s, especially without a family history of colorectal cancer, these polyps may never pose a real threat. Removing them may trigger a series of follow-up procedures, each with its own risks, without adding meaningful years to life. The science of aging helps explain why these risks increase. Blood vessels lose elasticity, tissue repair slows, and resilience to invasive procedures diminishes. Recovery times that once were measured in days can now stretch into weeks. The stress of the preparation, the sedation, and the procedure itself may take more from the body than it gives back in protection. Modern medical guidelines are beginning to adapt. The U.S. Preventive Services Task Force now emphasizes personalized screening decisions for older adults, encouraging patients and doctors to weigh the benefits and risks together. This is not about ignoring cancer prevention. It is about tailoring it to fit the realities of the aging body and the individual's health history. A safer, more balanced approach for those over 65 includes less invasive screening methods such as the fecal immunochemical test or stool DNA tests like Cologuard. These can be done at home, require no sedation, and carry virtually no risk of dehydration or falls. They are effective at detecting early warning signs of colorectal cancer and can be repeated annually or as advised by a physician. In addition, staying alert to changes in bowel habits, unexplained abdominal discomfort, or the presence of blood in the stool allows for prompt medical attention when it truly matters. True safety in healthcare means more than simply detecting disease. It means protecting quality of life, independence, and dignity. For those in their mid-60s and beyond, wise health decisions come from asking not only, can this test find something, but also, will this test truly improve my life if it does? Choosing a screening method that aligns with personal health history and goals is not neglect, it is a sign of maturity and self-respect. With the right conversations and careful decisions, it is possible to remain proactive about cancer prevention while avoiding the silent harms of unnecessary procedures. Number two, full body CT or MRI scans without a clear medical reason. There is an old saying in medicine, if you look hard enough, you will always find something. Nowhere is this more true than with full body CT or MRI scans. The promise sounds irresistible machines that can see every corner of the body, revealing hidden problems before they cause harm. For many people over 65, the idea feels like the ultimate form of prevention. But in reality, these scans can uncover far more than they solve, and not in a good way. The power of modern imaging means it can detect the tiniest irregularities, small nodules in the lung, tiny cysts in the kidney, or harmless spots in the liver. Most of these findings are benign, particularly in older adults. Yet the moment they appear on a report, they are given weight, often far more than they deserve. Fear takes hold, and the next step becomes a biopsy, a follow-up scan, or even surgery. Each step carries risk, especially for an aging body. Biopsies can lead to bleeding or infection. Surgery can result in long recoveries, chronic pain, or complications that never fully resolve. Consider the case of Thomas, a 70-year-old who attended a community health fair offering discounted full-body scans. He felt perfectly fine and had no symptoms, but curiosity and the desire to catch something early persuaded him. The scan revealed a small lesion on his adrenal gland, so small that it posed no threat to his health or lifespan. But the term lesion was enough to stir anxiety. Within months, he underwent surgery, which left him with long-term hormonal imbalance and fatigue. What began as an act of prevention ended up reducing his quality of life. Research supports this caution. Studies have shown that up to 30% of healthy adults undergoing full-body scans will have incidental findings, things unrelated to their health status that can trigger further testing. In many cases, these findings never cause symptoms, never shorten life, and never require treatment. Yet once discovered, the emotional and medical momentum can be difficult to stop. For older adults, the stress, cost, and physical toll of chasing these harmless shadows can outweigh any potential benefit. The physiology of aging adds another layer of risk. Lying still for long periods in an MRI machine can be uncomfortable or even painful for those with arthritis or back problems. The contrast dyes used in some scans can strain the kidneys, which may already be less efficient with age. And even without contrast, the sheer stress of repeated follow-ups can weigh heavily on mental well-being, replacing peace of mind with ongoing uncertainty. A more personalized approach is both safer and wiser. Imaging should be used to answer a specific question, not to satisfy general curiosity. If there are symptoms, persistent pain, unexplained weight loss, or new functional changes, then targeted imaging can be invaluable. But in the absence of such signs, the best prevention is often not another machine, but attentive, relationship-based care from a physician who understands your health history. There are more effective ways to invest in well-being after 65. Regular physical activity, balanced nutrition, adequate sleep, and meaningful social engagement all have a far greater impact on longevity and quality of life than scanning every inch of the body without reason. By focusing on how you feel rather than what a machine might find, it is possible to live with greater peace, vitality, and trust in your body's own resilience. In the end, the goal is not to know every hidden detail inside the body. The goal is to live well, with clarity, independence, and a sense of security that comes from wise choices, not from chasing every shadow a scan might reveal. Number 3, cardiac stress tests when there are no symptoms. At 71, Richard considered himself lucky. He had no chest pain, no shortness of breath, and still walked 2 miles every morning through his neighborhood park. During a routine checkup, his physician suggested a treadmill stress test just to be safe. Richard hesitated but agreed, thinking it was a harmless precaution. The test showed a questionable result, and within days he was sent for an angiogram. That led to a stent placement for what turned out to be a mild narrowing in one artery, something that, according to later review, might never have caused him trouble. The procedure left him with fatigue that lasted for months, and he experienced complications from the blood thinners he was prescribed afterward. What began as a well-intentioned screening ended up diminishing the very health it was meant to protect. Richard's story is not unusual. As the body ages, the heart naturally develops, changes slightly stiffer arteries, subtle shifts in electrical conduction, and a slower recovery after exertion. These differences are often normal for someone in their late 60s or 70s. Yet on a cardiac stress test, they can look like warning signs of disease. The machine cannot tell the difference between natural aging and true pathology. Once a test result is flagged as abnormal, the momentum toward further testing is strong. Angiograms, catheterizations, and even bypass surgeries may follow, each carrying risks such as bleeding, kidney injury from contrast dye, infection, or a dangerous drop in blood pressure. Scientific evidence supports a more cautious approach. A review in the Annals of Internal Medicine concluded that routine stress testing in asymptomatic older adults does not improve survival or reduce heart attack rates. Instead, it often triggers a cascade of interventions that bring physical risk, emotional stress, and unnecessary medical expenses. In the absence of symptoms, the likelihood of finding a life-threatening heart problem is low, but the chance of being drawn into an avoidable medical ordeal is high. Personalized medicine offers a better path. Stress testing should be reserved for when symptoms suggest possible heart disease, new chest discomfort during exertion, unexplained fatigue, sudden shortness of breath, or palpitations that interfere with daily activities. For those without symptoms, the focus should shift toward proven heart protective habits. These include regular, moderate exercise like brisk walking or swimming, a diet centered on whole foods and healthy fats, blood pressure and cholesterol management, and staying socially engaged to keep both mind and body active. A healthy heart in older age is not defined by how it performs under artificial strain in a clinical setting, but by how well it supports an active, meaningful life. The real test is whether it allows climbing stairs without gasping, playing with grandchildren without fatigue, and waking each morning with the energy to embrace the day. For many people over 65, preserving that vitality means avoiding unnecessary cardiac stress tests and trusting the daily evidence of a body that is already serving them well. Sometimes, the most powerful choice in healthcare is not adding more tests, but choosing the care that honors the life already being lived. Number 4. Repeating bone density scans too frequently. Dr. Clifford Rosen, one of America's leading osteoporosis researchers, once cautioned, a bone density scan is a tool, not a scoreboard. Repeating it too often will not make your bones stronger. It may only make you worry more. This warning is particularly important for people over 65 who have already been diagnosed and are under treatment for osteoporosis. Bone density scans, known as DXA scans, are excellent for diagnosing the condition and guiding the start of treatment. But once a care plan is in place, repeating the scan every year rarely changes the approach and can cause unnecessary anxiety. Bones remodel slowly, especially in older adults. Even with effective treatment, measurable changes in bone density often take 2 to 3 years to appear. Yet many patients are encouraged to undergo annual scans to check progress. The results may show slight variations that have more to do with machine calibration or positioning than with actual bone strength. Unfortunately, these small fluctuations can cause patients to believe their condition is worsening, leading to overmedication or changes in therapy that offer no real benefit and may even cause harm. Consider the case of Linda, a 9-year-old who was diagnosed with osteoporosis and started on medication alongside a nutrition and exercise plan. After just 1 year, her physician ordered another scan. The results were slightly lower than before, a change well within the margin of error. Alarmed, Linda doubled her calcium supplement intake and began taking her medication twice as often without consulting her doctor. Within months, she developed kidney stones and digestive issues that required hospitalization. The scan, which should have been a tool for guidance, ended up triggering a chain of harmful decisions. Studies from the National Osteoporosis Foundation confirm that in most cases, bone density scans should not be repeated more often than every 2 years, and sometimes even less frequently, unless there are new risk factors or fractures. The goal is to focus on proven strategies for bone health rather than obsess over small numerical changes. Weight-bearing exercises such as walking, stair climbing, or light resistance training strengthen bones over time. Adequate vitamin D, either from sunlight or supplements, and calcium-rich foods like dairy, leafy greens, and fortified products are essential building blocks. Balance exercises, such as Tai Chi or gentle yoga, help prevent falls, the leading cause of fractures in older adults. Overtesting not only wastes time and resources, but can also overshadow the importance of consistent daily habits that truly preserve bone strength. A scan is a snapshot. Your lifestyle is the full story. The real measure of success is not whether the score moves slightly on a chart, but whether you can maintain mobility, avoid fractures, and live independently. For those over 65, the wisest course is to discuss with a trusted physician how often bone density testing is truly needed. In many cases, spacing scans every 2 to 3 years, or even longer, is both safe and effective. The best protection for bones comes not from chasing frequent test results, but from steady, sustainable actions that keep the skeleton strong and the body in motion for the years ahead. Number 5. Screening for slow-growing cancers when there are no symptoms. What if discovering cancer early did not save your life, but instead made it harder to live? It is a question that challenges one of the deepest beliefs in modern medicine, that earlier is always better. For many people over 65, certain cancers grow so slowly that they are unlikely to ever cause symptoms, much less threaten life. Yet, once these cancers are detected, they often set into motion a series of aggressive treatments that may do more harm than the disease itself. Slow-growing cancers are not rare. Many prostate cancers in men, certain types of breast cancer in women, and most thyroid cancers fall into this category. These cancers may remain quiet for years, sometimes for the rest of a person's life, but once the diagnosis appears in black and white on a medical report, fear takes over. The word cancer carries enormous emotional weight, often leading patients and families to believe that doing nothing is the same as giving up. The truth is more complicated. In older adults, the risks of aggressive cancer treatment are magnified. Surgery comes with the danger of anesthesia complications, infections, and long recovery periods. Radiation can cause fatigue, skin damage, and inflammation of surrounding tissues. Chemotherapy can weaken the immune system, increase vulnerability to other illnesses, and strip away strength that might never fully return. Each of these treatments can interfere with independence, mobility, and the ability to enjoy daily life. The story of Robert illustrates this perfectly. At age 70, he was otherwise healthy and active. A routine prostate cancer screening found a small, low-grade tumor. His doctor told him it was unlikely to grow fast or become life-threatening. Still, the fear of having cancer was more than he could bear. He opted for surgery, believing it was the safest choice. The operation left him incontinent and deeply depressed, a shadow of the man he had been. Months later, a second opinion confirmed that the cancer likely would never have affected his lifespan. Robert's regret was as heavy as the physical challenges he now faced. Research backs up Robert's experience. A landmark study published in the New England Journal of Medicine followed men with low-risk prostate cancer for over a decade. Those who chose active surveillance, monitoring the cancer with regular checkups and imaging, had similar survival rates to those who underwent immediate surgery or radiation. The key difference was that the active surveillance group avoided the life-altering side effects that often accompany aggressive treatment. Similar patterns have been observed in certain breast and thyroid cancers, where observation is often a safe and reasonable alternative for older patients without symptoms. This is where the principle of personalized medicine becomes essential. The pace of cancer growth, the overall health of the individual, and personal priorities must all be considered. A cancer that might justify aggressive treatment in a 50-year-old may call for a gentler approach in someone 20 years older, especially if other health issues are present. The goal is not to ignore the cancer, but to manage it in a way that safeguards both longevity and quality of life. Watchful waiting, or active surveillance, may sound passive, but in reality, it is a structured and intentional form of care. It involves scheduled physical exams, imaging when needed, and clear communication between patient and doctor. It allows for swift intervention if the cancer shows signs of change, while avoiding unnecessary risks when it remains stable. Not all cancers behave the same way. Some are like wildfires, demanding immediate action. Others are like slow-moving clouds on the horizon, present but posing no immediate danger. The art of good medicine lies in knowing which is which, and having the courage to resist overtreatment when it offers no true benefit. For those over 65, the most important question is not simply, do I have cancer? But will treating this cancer improve the life I am living? When the answer is uncertain, thoughtful dialogue with a trusted physician can prevent unnecessary suffering. Sometimes the choice that preserves life the most is the one that allows you to keep living it fully free from the burdens of treatments for a disease that might never have truly mattered. Number 6. Comprehensive annual blood panels without a clear medical indication. Imagine sitting in a doctor's office at age 68, feeling healthy, with no new symptoms, and a steady track record of good checkups. The doctor, wanting to be thorough, orders a comprehensive blood panel that tests for dozens of markers, everything from rare hormonal disorders to obscure vitamin deficiencies. A week later, the results arrive, and one number is slightly outside the normal range. It might be something harmless, perhaps related to what you ate the night before, or even a small variation in the lab's equipment. But once it appears on paper, the journey begins. Repeat tests, specialist visits, scans, and sometimes even treatments for something that was never a real problem to begin with. This scenario plays out more often than many realize. Comprehensive blood panels without a specific reason can be like fishing in a vast ocean without knowing what you are looking for. You are almost guaranteed to catch something, but it may be nothing you actually need to worry about. In older adults, natural variations in blood chemistry are common and often harmless. Yet each abnormal result, no matter how trivial, has the potential to create a cascade of follow-up procedures that carry financial, emotional, and even physical costs. One example involved Janet, a 70-year-old in excellent health. Her annual blood work included an extended panel that tested over 30 markers. One showed a mild elevation in an enzyme linked to liver function. She had no symptoms, no history of liver disease, and her other tests were normal. Still, the finding led to an ultrasound, then an MRI, and finally a liver biopsy, all of which were stressful and uncomfortable. The result? No disease was found. The abnormal enzyme level was simply her personal baseline, a normal variation for her body. The months of worry, the invasive procedures, and the bills could have been avoided entirely. Medical research supports a more targeted approach. Studies have shown that routine broad-spectrum blood testing in healthy adults without symptoms rarely uncovers serious illness, but it frequently finds incidental abnormalities that are clinically insignificant. In older adults, the odds of these false alarms increase due to the body's natural aging processes, changes in metabolism, and the way organs function over time. Personalized testing is a safer and more effective strategy. Blood work should be guided by specific questions. Is there a symptom that needs explaining? Has there been a meaningful change in health or lifestyle? Are there existing medical conditions that require monitoring? When tests are ordered with a clear purpose, the results are more likely to be meaningful and actionable. For those over 65, an annual physical can still be valuable, but it should focus on conversations about health goals, physical function, mood, nutrition, and daily activities. Routine tests like cholesterol, blood sugar, and kidney function may be appropriate based on history, but the habit of ordering every possible test just in case can lead to more harm than benefit. The goal of good health care is not to find every variation inside the body, but to identify what truly matters for maintaining strength, clarity, and independence. When testing is thoughtful and targeted, it not only reduces unnecessary worry, but also keeps attention on what actually improves quality of life. Sometimes, the best choice is to skip the fishing expedition and focus instead on the waters that truly need navigating. The heart of this message is simple but powerful. Living long is good, but living well, living freely, and living peacefully is better. After 65, every year is a treasure, and the true art of health lies not in adding more tests, pills, or hospital visits, but in choosing what truly nourishes life. Medicine can help us, yes, but too often fear makes us chase every scan, every blood test, every just-in-case procedure, as if the secret to safety lies in finding more problems. The truth is, not everything that can be tested needs to be tested, and not every risk deserves your peace. Look at the quiet lessons behind these stories. Helen's life changed forever, not because of illness, but because of a fall caused by a preventive test she didn't truly need. Thomas went searching for reassurance and lost his energy to unnecessary surgery. Robert fought a cancer that would never have harmed him, and in doing so lost his joy. Each one reminds us sometimes the biggest threat to our well-being isn't disease, but the fear of it. Aging gracefully doesn't mean surrendering, it means understanding. It means recognizing that your body has earned the right to gentler care, that rest and balance can heal more than any machine can measure. It means trusting your inner wisdom, the same wisdom that has carried you through decades of storms, love, loss, and growth. Modern healthcare offers many tools, but wisdom teaches us when to use them and when to say, no, I choose peace. The truest kind of prevention isn't endless testing, it's listening to your body. Staying active, eating well, sleeping deeply, and surrounding yourself with people who make you laugh. It's walking in the morning sun. It's the strength of gratitude. It's the calm that comes when you stop worrying and start living again. Because at the end of the day, the goal is not just to add years to life, but to add life to your years. The best medicine for aging is meaning, purpose, love, and the courage to choose quality over quantity. So next time someone tells you, let's test this just to be safe, take a breath and ask, will this make my life better or just make it busier? The answer to that question might save you more than any scan ever could. Thank you for watching this video. If you found it valuable, please share it so more people can learn how to protect their health and independence. And if this is your first visit to our channel, don't forget to subscribe so you won't miss our upcoming stories and insights. We'd love to hear your thoughts. What part of this message spoke to you most? Leave a comment below, and let's keep this conversation going. Until next time, stay healthy, stay peaceful, and cherish every beautiful day of this precious stage of life.